Hey friends, Dr. Christy here, and I come to you a little embarrassed today. Let's talk about cold sores. If you've ever had a cold sore, you know the intense burning, the pain, the itchiness, that irritation, and then quite frankly, the embarrassment and mortification that comes along with showing this kind of face in public. Yes, I even have these. I've had them since I was a kid, and they come and go periodically. If anybody is familiar with them, it is developed from the herpes simplex 1 virus. Yes, it's oral herpes. Congratulations to me, I have it too. I don't know how I got it as a child, sharing a cup with my parents, something like that. Either way, I have this virus in my system. And this virus gets activated when we're sick, when our immune system is suppressed, and we can't necessarily fight something off as freely as we would ordinarily. And then of course, stressed. So when these things happen, I came to you today to talk about what I do when I get an outbreak and how to reduce the frequency and intensity of the outbreaks when they come on. So first and foremost, I'll share my story this particular time. And most of the time actually at this point, they only happen after I have a cold or if I have illness of some kind. So recently, this last couple weeks or so, I had a cold. I did all the immune support that I possibly could. I got over the cold in a few days, not really a big deal. And then what happened? Boom. And quite honestly, next time I get sick, maybe in the next 6 to 12 months, I will try a new tactic and let you know if it works. I simply believe that I didn't give what I was doing a long enough chance to suppress what was about to come out. Because when I get a cold and I'm blowing my nose, this is where I get it now. It's that constant irritation, and my nervous system and my immune system gets stressed, and that's where they now come out. However, I was doing a couple different supplements, which I'm going to tell you about what they are. And I believe, because after I was over the cold, I literally had an entire day where I felt amazing. It was clear, no issues whatsoever, and I stopped. And I think I should have taken it 1 or 2 more days even of taking those supplements, and I think it would have made a bigger difference in not allowing these things to come out. But here we are. Either way, it's given me an opportunity to share my story with you and give you some extra tips so that when you have this situation come up, whether it's after an illness or if you're stressed or something, what are some things that you can do at home to help control this? Number 1, keep your immune system in check. Number 1, of course, is always keep your immune system in check. If you are extra stressed and you get a cold, it's like a double whammy. It really impacts your system even harder. So immune system support, vitamin C, vitamin D, zinc, and then lauricidin. I have mentioned this supplement before. Lauricidin is highly antiviral. It's essentially concentrated coconut oil extract. You're going to look for, if you can't find lauricidin specifically, you can find monolaurin, which is a very similar impact. So you take it in high quantities. That will help any viral load, whether it's from cold sore virus or any virus for that matter. So number 1 is always immune support. Number 2 is essential oils. So at the very first sign of a cold sore brewing, where you start to feel that little tingle or you start to see that little blister start to develop, I act immediately and use tea tree oil topically. I've used lemon balm before. Even a little apple cider vinegar will be helpful, diluted of course, and then even straight up coconut oil. There's other oils that I've heard are helpful. I have not used the other ones. Lavender I have used a couple times as well, but I know thyme and some other ones can be useful. Those are just ones I'm personally not as familiar with. So essential oils topically, sometimes they need to be diluted, so please check into that. Can be very powerful when used consistently and frequently to reduce the infection. And number 3, of course, I'm sure you've all heard this before, and it's lysine. The amino acid arginine, when it's higher in the body than lysine as far as the ratio is concerned, it leads you more vulnerable to having this kind of outbreak. So keeping your lysine levels higher than your arginine levels is critical, especially when your body is stressed and imbalanced and more likely to get an outbreak like this. So those are my big 3 tips, of course: immunity, essential oils, and then the lysine. And then last, of course, is always simply reduce your stress level and patience, rest, water, and just take care of yourself. And sometimes it just is what it is, and you just gotta wait it out, and that's okay. Be real with yourself. It doesn't mean that I'm any less of a good human or a good doctor or I'm any less healthy just because things happen sometimes. So give yourself some grace, take care of your body, take care of your mind and spirit. And if you have any other questions, go ahead and drop them below. Have a good day and I'll talk to you soon.